Glipizide is one of the popular medication used for the treatment of diabetes. This medication belongs to the category of sulfonylureas. However, this medication is not indicated for the treatment of type 1 diabetes. In this video, let's cover important facts about glipizide. First, let us see the hypoglycemia produced by this medication. Glipizide works by reducing the blood glucose levels, thereby it is useful in the treatment of diabetes. However, when it is used at higher doses, it can produce one of the condition, hypoglycemia. This hypoglycemia is associated with many symptoms like increased sweating, shakiness, increased hunger, and weakness. In severe conditions, it can also produce confusion, dizziness, and irregular heartbeats. A severe hypoglycemia is fatal to the patient, therefore it should be promptly avoided. Glipizide can act on the beta cells of pancreas where it is going to increase the insulin release, so it reduces the blood glucose levels. But at higher doses, it can produce the hypoglycemia, and any other factors which promote the insulin release can further increase the risk of hypoglycemia. Even though hypoglycemia produced by glipizide can be controlled properly, but in presence of few risk factors, this hypoglycemia may be more pronounced. For example, in people with malnutrition, because of nutritional deficiency, the energy levels are reduced, and glipizide is going to reduce the blood glucose levels, which results in the increased risk of hypoglycemia. So in such people, glipizide should be carefully used, and if it is required, the dose may be reduced. While you are taking glipizide, you should take caution, and any prolonged exercise may reduce the glucose levels, leading to hypoglycemia. So try to avoid prolonged exercises while taking glipizide. A high consumption of alcohol can also increase the risk of hypoglycemia when you are taking glipizide. Not only these factors, few of the other medications can also reduce glucose levels. For example, other glucose lowering agents can further increase the hypoglycemia. Particularly, insulin can have more effect when it is combined with glipizide. Similarly, if you have the diuretics, can also reduce the glucose levels in the body. Therefore, when they are combined with glipizide, they can further increase the hypoglycemia. Beta blockers like propranolol, atenolol, which are used to treat hypertension, if they are given along with glipizide, you may have increased hypoglycemic effect because these medications can also reduce your glucose levels. So glipizide should be carefully combined with other drugs which again reduce glucose levels. However, few other medications can increase the glipizide levels by different mechanisms. They may reduce the metabolism of glipizide, otherwise they can displace the glipizide from the protein binding sites. By any of these mechanisms, glipizide levels are elevated, leading to severe hypoglycemia. For example, many of the NSAIDs can increase the glipizide levels when they are combined. So when you are taking glipizide along with any painkillers, you should be careful to monitor any symptoms of hypoglycemia. Similarly, sulfonamides which are used to treat bacterial infections may also elevate glipizide levels because sulfonamides are again chemically related to sulfonylureas. Therefore, they can displace the glipizide from the protein binding sites which increase its levels, leading to more effect on lowering of glucose levels. Probenecid is another drug which is used to treat gout by increasing the uric acid excretion. This medication can also increase the glipizide levels. Similarly, MAO inhibitors can also elevate the glipizide levels. So all such type of drugs may increase the risk of hypoglycemia. That's why whenever you combine glipizide with other drugs, you should be careful, and any development of symptoms of hypoglycemia should be thoroughly treated. In case of hypoglycemia, immediately you can eat a sweet candy or drink sweet fluids to restore the glucose levels. However, be careful that without any symptoms of hypoglycemia, taking sweet content may lead to loss of glycemic control. When you need insulin, in few of the conditions you need insulin. For example, people who are having the recent surgery, glipizide is unable to control the glucose levels. So in such people, glipizide is discontinued and insulin is administered. Similarly, if you have any trauma, fever, or recent infections, again the glycemic control may be lost, leading to elevated levels of glucose. So in such conditions, glipizide is ineffective, therefore it should be discontinued and insulin should be administered to control the elevated glucose levels. When glipizide failed to work, Few of the medications can elevate the glucose levels, which may reduce the action of glipizide. Many of the corticosteroids can elevate the glucose levels. For example, prednisone, methylprednisolone, and so many drugs can increase the blood glucose levels. Therefore, they can reduce the action of glipizide. Normally, these corticosteroids are given as anti-inflammatory agents, otherwise to suppress the immunity in people going for organ transplantation. In such conditions, corticosteroids should be carefully used because they reduce the action of glipizide. And when you're taking thiazide diuretics like hydrochlorothiazide, particularly at higher doses, it can increase the glucose levels and reduce the action of glipizide. Similarly, thyroid agents and phenothiazines, which are used as antipsychotics, all such medications can increase the levels of glucose, thereby they can reduce the action of glipizide. When you should not use XL tablets. Glipizide is available in two formats: normal tablets, which are also called as immediate release tablets, as well as extended release tablets. These extended release tablets are denoted by letters like XL or ER. From these tablets, glipizide is slowly released and uniformly distributed throughout the day. Therefore, the release pattern should not be disturbed by any physiological disorders in the body. In people with narrowing of esophagus, taking ER tablets may result in irregular release of the medication, which may either increase or decrease the actions of glipizide. Similarly, in the people with decreased GI motility, use of extended release tablets are not preferred. Next one is the allergy produced by this medication. Glipizide is classified as a sulfonylurea. So it is having the allergic reactions that are related to sulfonamides. So with use of glipizide, few people may have skin rashes, itching, and redness and swelling of the skin. Interestingly, in a few people, cross-reactivity can also be observed. That means if you are taking sulfonamide antibiotics and you are developing allergy, the same allergic reactions may be observed with use of glipizide. So in such case of cross-reactivity, you should not use the glipizide because they are fatal to the people. However, these allergic reactions are not observed in all people, and in a few people, mild skin rashes can be observed. When to avoid this medication? Glipizide is not suitable for all the people. The first thing, it is not suitable to treat type 1 diabetes because this medication is going to increase the insulin release. In the type 1 diabetes, insulin deficiency is observed, where administration of external insulin is only the possible option. So in type 1 diabetes people, glipizide is ineffective. Similarly, in the people with diabetic ketoacidosis, glipizide is ineffective. This is a fatal condition of elevated glucose levels where glipizide is unable to produce glycemic control. Finally, glipizide should be avoided in the people who develop allergic reactions. Exposure to sunlight. Glipizide can produce one of the condition photosensitivity. Those people who are taking glipizide may have photosensitive reactions. So when they are exposed to direct sunlight, they may have sunburns, swelling, and blisters on the skin. Therefore, if you are taking glipizide and you are working in an area which is highly exposed to sunlight for longer periods, proper precaution should be taken because it may develop sunburns on the long-term use. Anemia produced by this medication. Glipizide can produce one of the condition hemolytic anemia. This is the loss of hemoglobin due to the breakdown of red blood cells. In such people, we can observe yellow skin, yellow eyes, and jaundice-like symptoms. They may also have dizziness, confusion, and weakness. However, this side effect is not observed in all people. This hemolytic anemia is observed in the people with glucose 6-phosphate dehydrogenase enzyme deficiency. This enzyme is required for formation of RBC, but in its deficiency, the breakdown of RBC is more pronounced, leading to hemolytic anemia. However, you should be careful when you observe any symptoms like yellowish skin or yellowish eyes, which may indicate the development of anemia due to use of glipizide. How and when to take this medication? Glipizide is available as tablet and it is started at a dose of 5 mg. The target dose depends on the type of tablet you are going to take. In case of immediate release tablet, the maximum dose is 40 mg per day. In case of extended release tablet, the maximum dose is 20 mg per day. Initially, glipizide is started at a low dose and it is given 30 minutes before the meals. When it is given once a day, it should be taken 30 minutes before the breakfast, and later, based on the glycemic control, the dose can be given twice daily. However, in case of external release tablets, it is always given once daily, and these tablets are specially designed and specially coated. Therefore, they should not be crushed, chewed, or broken, as it results in loss of extended release pattern of the medication. So these are the various facts about this glipizide, which is used to control type 2 diabetes mellitus. Development of hypoglycemia is one of the important conditions that is associated with glipizide, which may be elevated by so many factors. So while you are taking other medications or doing prolonged exercises or under malnutrition, this hypoglycemic effect may be more increased. This medication can also increase the photosensitivity. That's why avoid direct exposure to the sunlight for longer periods. Hemolytic anemia can be observed in the people with glucose 6-phosphate dehydrogenase enzyme deficiency. Being a sulfonylurea, this drug can produce allergic reactions in a few people, particularly who are sensitive to sulfonamides. In a few conditions like surgery, trauma, or infections, glipizide may be discontinued and insulin may be administered to produce better glycemic control. So these are the different facts about glipizide that you should know before its use. If you really like this video, please subscribe to our channel and hit the like button to support our work. Thanks for watching. See you in the next video.